One of the 55 samples sent to a lab in Trinidad and Tobago tested positive for the Zika virus. The country's second Zika patient has been identified as a 16-year-old male resident of Echoes on the east bank of Demerara. At a news conference earlier today, Chief Medical Officer Dr. Shamdeo Prasad refrained from providing much information on the infected teen, but noted that he has been recovering well and has even returned to school.
The person has no history of any travel outside of Guyana. He did visit one of the hinterland regions more than a month prior to the occurrence of his symptoms. He started with fever and then came down with a rash and red-eye conjunctivitis. Investigation, of course, once we got the confirmation, was initiated.
With the vaccine to treat this mosquito-borne virus being at least 18 months away, the panic is heightening, especially since neighboring Venezuela has announced only recently that 3 persons have died as a result of Zika-related complications. Zika, now believed to be transmitted through sexual contact, is being linked to microcephaly, a neurological disorder in which babies are born with abnormally small heads. Among the many severe issues that this causes is death. Dr. Prasad is assuring that the government is looking to pull out all the stops to keep the virus at bay.
The premises were visited and there are 4 members in the household. They were all interviewed. We are in the process of sampling and testing those persons to see any possible occurrence.
The country's first Zika case was a female who also resided on the East Bank corridor. She too is said to be recovering well. Guyana has been listed by the World Health Organization as one of the 24 countries where the Zika virus exists. This has not yet made a dent on the country's tourism figures, and all efforts are being made to ensure that it stays that way. The Zika virus is spread by the very mosquito responsible for spreading dengue and the chikungunya virus. The symptoms of Zika include fever, rash, joint pain, red eyes, and headache. Also, many of these symptoms are very, very mild and can possibly be overlooked by Guyanese. But the Ministry of Health is warning against this, especially when it comes to pregnant women or women who may become pregnant. Basil?